Hello, welcome back. I am so excited for you to be here today to watch this video. I had the wonderful opportunity to interview someone very special, and I'm so excited to have you hear what she has to say. If you are new here, my name is Kara, and I run the blog Passion in the Purpose, and I also have a nonprofit, Our Hearts Align, which is dedicated to serving people, families who've had pregnancy loss. And today I got to sit down with Dr. Brooke Silberhorn. She is the owner of Thrive Chiropractic, and she has a specialty working with moms with their fertility, for their preconception time, during their pregnancies, and even after their pregnancy. She works with the whole family, and I had the opportunity to sit down, ask her some questions about fertility and her scope of care, and I'm really, really excited for you to listen to what she has to say.
So thank you so much for meeting with me. I am so excited to talk with you, and especially once I learned about what you actually do, I was so excited, not only just for learning about my own health and women's health, but also for our moms that we serve with Our Hearts Align. So I'm really excited to talk about everything with you. Celia. Hi. What's up? Can you go out with Ava? Can you go watch a show with Ava? Please? Okay, sorry. So I actually was introduced to chiropractic care during my previous pregnancy. Celia was actually a breech baby, and I started seeing a chiropractor in town, and she helped me flip her. And so I briefly know a little bit about chiropractic care, but I know that you have a specialty, and I just would like to talk to you a little bit more about that today. So if you could just briefly introduce yourself and your business, and we can go from there.
Sure. And thank you so much. I love what you're doing and love that we can work together to help moms who just want to be moms and have a baby. So my name is Dr. Brooke Silberhorn, and I am the owner and chiropractor of Thrive Chiropractic. And ever since I was in chiropractic college, I knew I wanted to work with pregnant women and babies, and help families to be their very best. And I was doing that for several years. I've been in practice for almost 14 years, which is crazy. And then about 6 years ago, I was diagnosed with thyroid cancer. The interesting thing is, prior to that diagnosis, I went on an almost year-long quest to try and figure out why my baby had severe eczema. And so in finally coming to my own diagnosis, I realized that her health challenges were because of my own health challenges. And that led me on a journey to learn more about this thing called preconception, and making sure that couples are fully healthy and thriving before they even try to conceive a child. And that when we do that, not only does that improve chances of conception and a healthy pregnancy, but we're finding through epigenetic research, which is a big word to say how the environment impacts your genes, that we can actually help couples have a healthier child through the work that I get to do.
It's just amazing.
Yeah.
Love it.
Yeah, I love it. It's a lot of fun, and yet it's hard work, because of course you're dealing with couples who sometimes have struggled for years, and in a lot of cases this is their last ditch effort. They've been told by fertility clinics, traditional medical fertility clinics, that They don't know why they can't get pregnant, and there's nothing that they can do to help them further because they've done rounds and rounds of IUI and IVF and every possible thing that they could do, and they're not pregnant.
Okay, so if you have a mom who maybe after watching this video says, you know, I want to get healthy and I want to start making steps in the right direction, so how, like, what would you suggest for her to be doing?
So the protocol that I use has 8 essentials, and chiropractic is one of them. And the reason that chiropractic is foundational is not that you're dealing with back pain or neck pain. Yes, that happens, and chiropractic is helpful with that. But rather that we know as chiropractors that your brain and nervous system control the function of literally every cell in your body. And that includes your reproductive organs and your hormone health organs, your thyroid, your adrenal glands, all of those things that impact how your body functions and your hormones and all of that stuff. So by making sure that your nervous system is functioning optimally, that your spine is in proper alignment, and is not interfering with those signals between your brain and your body, then that is pretty important. So many people know, oh, I need to eat right. I should exercise. Those are things that I should do to be healthy. And yet, if your nervous system is getting altered signals from the body, it's going to only respond with an altered response. So negative information into the brain, negative information out. Your body's not going to utilize all of those good nutrients and all of the movement that you're doing for your maximum benefit. So chiropractic basically is just part of a truly healthy lifestyle to make sure that everything else you do is utilized to the maximum.
That makes a lot of sense. I mean, I think about the inside of your body too. When you're trying to be healthy and get healthy, and to have a healthy pregnancy, hopefully.
Yeah.
So I think it's really important.
Yeah. So the other of the 8 essentials, a lot of them are actually pretty common sense things that in some situations people really just need a guide to remind them to make sure that they're on track. It is eating real food and getting good nutrients into your body that way. It is moving. It's getting water, hydration. There are specific supplements that I recommend that one of them is a little counterintuitive, and I can definitely go further into explaining that if you want, or we can...
Sure, go ahead.
Okay. So one of the supplements that I recommend are called glyconutrients. And glyconutrients are an essential sugar. And I know what you're thinking.
Sugar,
it's bad for you. And I thought the same thing the first time I was introduced to these supplements was, no, that can't be right, because sugar is bad for you, and how could sugar be good for you? But what we were learning about the structure of cells and how our cells communicate with each other is that on the outside of your cell are these little tree-like structures called glycans, and it is a combination of a sugar and a protein molecule that are on the outside of the cell that basically allow cells to come together and share information. And So when it comes to conception and fertility and pregnancy and beyond, that is incredibly important for your cells to be able to communicate with each other and share information. And I think that fertility is actually like the best example whatsoever of the necessity of this, because for conception to happen, you need two cells, an egg and a sperm, to communicate with each other and come together. So that is one of the things that I recommend and is very important for the protocol that I use to help couples.
Oh, that's really interesting.
Yeah, it's really cool.
I actually tell our girls, I'm like, there are good sugars and there are bad sugars, and let's try to keep it the good sugars.
Right. Yes. Yes.
So it's good to know that our body actually does need certain sugars.
Yeah, I mean, if you think about...
And fats, right?
Yes, yes. And that's, again, that's just all part of it. Fat is a big part of it as well. Like, in some cases, I recommend eating an avocado a day.
Oh, we would be good. We eat lots of avocados in our house.
Me too. And then, you know, getting your omega-3 fatty acids and your vitamin D, those are two of the essential nutrients that I also recommend. But probably one of the hardest things for especially women, but I think, well, men too. And I'm going to add, it's not just women that I see, although that's my passion. I want to help women be healthy, you know, before they get pregnant, during their pregnancy, after their pregnancy, which is also incredibly an important time for a woman's health. But I do care for men, and when I'm seeing couples who are facing fertility challenges or just are like, know that they want to start their family and they want to do it right, I want to see both of them, because a baby is made up of two people's genetics. Right. So we want the best expression of both of their genes to come together to make this beautiful, wonderful baby. But going back to my point, I think that one of the more difficult things is mindset and empowerment. And so a big part of this protocol is to really help couples to feel empowered through this journey and to have a mindset that, yes, this is a struggle, and to feel those emotions, but also to know that this struggle is making you the most amazing person, parent to come. And I know for my own journey through cancer and restoring my own health, like, that was something that I had to come to, that it was not this bad thing that happened to me, but it's just part of my journey to make me a stronger and better person so that I can then pay it forward and help others because of what I've gone through.
That's so amazing.
Yeah.
I love it.
Yeah, which, I mean,
it's similar.
Knowing your story and everything that you've gone through, and then, you know, how you turned it around to be able to help, you know, help so many moms is awesome.
That's the goal.
Yeah.
So, okay, if you're helping women with conception,
Mm-hmm.
and their fertility, getting that on track, so I am super thankful that you are helping me with my current pregnancy.
Yeah.
What exactly are your goals or the family's goals during pregnancy, throughout the pregnancy?
Yeah. Well, honestly, sometimes it's hard because I want so badly to, you know, like, the protocol I use is for fertility and preconception, but in reality it's just a wellness protocol and that it's beneficial for everybody. And so all of the recommendations that I have for preconception and fertility are very similar going through pregnancy. we want to make sure that your nervous system is functioning optimally so that as baby is developing inside of you, you've got all the signals going, sending messages in the right way. What was I saying?
You said you're working on the nervous system, make sure everything is functioning
Yes.
I can't talk either.
Yeah, so, through pregnancy, we want to make sure that the nervous system is functioning optimally so baby can develop optimally as well. And also so that mom can feel great through her pregnancy. A lot of what we're finding, so backtrack just a little bit, I am part of a group of chiropractors across the world who utilize Schaefer protocol, which was developed by a friend of mine. And what we're finding in all of the offices that have had Schaefer protocol babies, that the moms don't experience things like morning sickness and hyperemesis gravitum and gestational diabetes and all of the somewhat normal pregnancy maladies. So there's that doing the work before you get pregnant is hugely beneficial for your pregnancy. But then also during pregnancy, chiropractic is great for just making sure that you're not having as many of those typical pregnancy pains and symptoms, and preparing you for the most successful birth that you possibly can have. Like I said earlier, I love working with pregnant women, and that's where I started when I was a student before I was introduced to the preconception world. And I'm certified in Webster technique, which is sometimes in layman's terms, people associate it with turning babies, but the reality is that's not what we do. It balances the pelvis so that baby has the most room for optimal position, and when that happens, typically babies will turn on their own. So, yeah.
I'm very familiar with that.
Yes. So, yeah, I mean, I've had a lot of moms in the past who have gone through their pregnancy with me and have just incredibly amazing births that, their labor time isn't super long and their time pushing is not very long as well, which when you hear stories of moms who labor for 48 hours before having to have a C-section, it's like, oh my gosh, so we hope for optimal alignment so that you don't have to go through a lot of those things.
No, I cannot imagine.
Yeah. Me either.
So as I'm working through our pregnancy, I'm going to look forward to the future as well. So what are some things that you would like to do for aftercare? Because you said that's really important.
Yeah. One of the things that we're learning, and it's actually from a book that I read by a medical doctor who has seen a lot of this in his practice, is that women, when they go through pregnancy and they give birth, that fourth trimester after giving birth, they are so depleted and not supported, unfortunately, in our society. Support of new moms it's just lacking in our society. So again, making sure that before pregnancy, during pregnancy, and after pregnancy, we're supporting mom's body as well, making sure that she has the nutrients that she needs, that she's getting the rest that she needs, and that alignment. Your body goes through huge changes during pregnancy, and then in a very short period of time, all of those changes try to snap back to a new normal. And so getting adjusted after you give birth basically just helps guide your body into really good alignment as it's trying to restore itself to a post-pregnancy body.
Something I wish I would have focused on a little bit more in my previous pregnancies, because I feel like the second pregnancy probably would have went better if I would have realigned myself a little bit.
Yeah.
But she knocked me out of whack a little bit.
Right. Yes. Pregnancy is really hard on you. And I mean, I know for myself with my first daughter, I mean, again, everything that I've experienced has led me to this point in my life that I can help women learn from my own mistakes. So I was not intentional about my pregnancy with my first daughter. And I had unbelievable all-day sickness. I was very sick through my pregnancy. And then I also had severe sciatic pain for the second half of my pregnancy. So very stressful pregnancy. My daughter was born 5 weeks premature, and I did my very best to take care of myself. I did have support, thankfully, from my mom so that I was able to finish chiropractic college. But I had sciatic pain for a good 6 months after she was born. And I was getting adjusted on a regular basis, so that piece was in place, but what was not in place was rest. And so that is another part of the protocol that we talk about. Rest isn't just getting sleep, it's listening to your body and taking that time to not just keep going.
A lot of people don't talk about the fourth trimester, and you're right, like moms are kind of forgotten after like a week or two after having the baby, and they're just home alone, and sometimes dads had to go back to work by then, and it could be very lonely and isolating. And so you're right, we definitely need to be focusing a little bit more on us and our care and figuring out maybe things to put in place ahead of time.
Right, exactly. It's interesting, that medical doctor that I spoke of who wrote the book is called The Postnatal Depletion Cure, and his name is Oscar Seralak. I think that's how it's pronounced. And what he said is that postnatal depletion can mimic symptoms of postpartum depression or anxiety. So what a mom thinks is all in her head could actually be her body crying out to say, you've stolen from me, essentially, and you're not giving me what I need to repair and restore and function. Babies take a lot out of you, and so that's, again, why I'm so passionate about preconception, because you can prepare yourself for that and make sure that you don't get to that point of depletion. And I think for myself, that's that is a part of what led me to my thyroid cancer diagnosis, that I wasn't fully taking care of myself. I thought I was, but there's more to that story, I know, but I think it's part of it.
It's a lot to think about.
Yeah.
And things that maybe we don't naturally think about.
Yeah.
So it's important for mom to get her care afterward, but I've briefly heard a little bit about babies actually needing care afterward, or maybe helping with certain things. So can you speak a little bit to that? Because I don't really know a lot, and I don't think a lot of people do either.
Yeah. I've heard it so many times. Why on earth would a baby need to be adjusted? They don't have back pain.
Right. And I'm like, I just don't want to mess anything up with my baby.
Right. Yes, that too. Because people are envisioning a very forceful manual adjustment, which is not how babies are adjusted, and it's not the technique that I do at all. But birth is the first trauma that you have to your spine and your nervous system. So statistically, we have found that even in normal, uncomplicated, natural vaginal birth, there's 80% chance of injury. So no forceps, no suction devices, the doctor is not helping by pulling the baby's head and neck. There's 80% chance of injury. And a lot of times that injury goes unnoticed because no one's checking to see how is the nervous system functioning. And a lot of issues that parents have with their babies in those first months and even first few years can be tied back to that. Colic, problems breastfeeding, problems sleeping, all of those things can be tied to the fact that that baby just needs to be checked by a chiropractor. And so I'm gonna share a story with you because it brings tears to my eyes when I replay it. But I have worked with some babies who have dealt with lip and tongue tie issues, which preconception work helps to prevent that.
Wow.
Sidebar. But so they obviously see a pediatric dentist who does laser revision of those lip and tongue ties, but cranial work and chiropractic work helps to make sure that they have good alignment of their cranial bones and that the revision is successful. So I had a woman reach out to me this summer, and she had actually brought her son in a couple of years ago due to lip and tongue tie issues, had really great success with him, and she called me and said, my sister is in town and her 5-week-old has lip and tongue tie issues, and can you help him just over a course of a couple days? And I said, of course. And so I adjusted him several times over a period of 4 days. And some of the things that his mom, his aunt, and his grandma all noted were he slept better. He was calmer. He actually had difficulty turning his head to one side, so he was able to do that. We were starting to see changes in the shape of his head. But probably the best comment came from Mom when she said, I really struggled with my connection to him. I didn't want to...
Can you come sit with us?
Yeah.
Dr. Brooke up.
She said for that first 4 weeks, she struggled to want to hold him and to spend time with him and to cuddle with him. And mind you, she wasn't getting adjusted. Only he was. But she felt a greater connection with him because of the work that I was doing on him. So just think what would happen if both mom and baby were getting adjusted. Because they're connected within themselves, they're able to have greater connection to each other.
Wow.
And that's why I love what I do.
Yeah, that's awesome. That's so amazing. Well, thank you so much for talking with me and teaching me. And I mean, I'm sure we could talk for hours and hours about all of this and more.
I could, for sure.
I just love learning, and I hope that other moms will benefit as well, because just women's health is lacking so much in our country and our world, and I feel like that's something that we really need to put more of a focus on, and us like have important conversations like this. So
yes.
Thank you so much.
Thank you so much.
Thank you so much for joining me today. I hope that you learned something from the interview with Dr. Brooke. I know I sure did. The funny thing is, actually, I asked her to do this interview first, and then I found out that I was pregnant. So now I was like, I have to start coming to see you now. So now I am a patient of Dr. Brooks. I am seeing her every other week, and it has truly been amazing so far for my first trimester of this pregnancy. So I highly recommend you reach out to her and talk with her. If you are local, then obviously you can go and visit with her and become a patient as well. Or if you're not local, then you can find her online, and she has great opportunities to connect with her online. So her website is thrivewithchiro.com. That's thrivewithchiro.com. And on Facebook, she has a really great closed Facebook group that you can join, anyone can join, and it's called Faithful and Flourishing Fertility. And in there, she talks all kinds of things about fertility and pregnancy and women's health. And it's a really, really great group to be a part of. And if you want to just like her Facebook page or something, that is Thrive Chiropractic Ocala. So I will put all of the links to her connections down below in the description box. And if you would like to learn more about me and what we do here, you can find me at passioninthepurpose.com. I also have Facebook and Instagram and obviously YouTube at the same name, Passion in the Purpose. And if you'd like to learn a little more about what we do for pregnancy loss, you can find me at ourheartsalign.org or also on Facebook at Our Hearts Align. So thank you so much. I hope you have a wonderful day, and I will catch you next time. Bye.